Doctors are finding if a pregnant woman contracts COVID-19, she is more likely to suffer complications that land her in the ICU. That's exactly what happened to one Madera woman. She not only fought for her own life, but for her unborn baby as well. And after months of specialized care at Community Regional Medical Center, she and her baby were finally able to go home.
This moment has been a long time coming for Gabby Manos. She was discharged from Community Regional in November after 2.5 months in the hospital. A few months into her pregnancy, Gabby says she started experiencing flu-like symptoms.
It kept getting worse, and even my body fell off. Like I just didn't feel right. And the cough felt like, oh my gosh, this cough's never gonna stop. And just my fatigue was really bad.
Her mother rushed her to the hospital, and it was there where she tested positive for the coronavirus. Dr. Mohammed Fayed is a pulmonary critical care physician at Community Regional and was one of many medical professionals who worked on Gabby's case.
Her course has been rocky because she never really get better. And after several days, it come to the point that we had to induce labor to try to see if that would really help her survive.
Gabby had an emergency C-section at 34.5 weeks and delivered a 3-pound, 5-ounce baby girl. Her daughter, Madeline Rose, went straight to the neonatal intensive care unit while Gabby continued to battle COVID-19.
And after 18-20 days of mechanical ventilation, she was clearly failing all the measures to save her life.
Gabby was near death, so in a last effort to save her life, Dr. Fayed says she received ECMO treatment.
It's a machine that can take your blood that doesn't have oxygen and have carbon dioxide. You just put it in a machine, you give the blood oxygen, you remove the carbon dioxide and give it to the patient again. It's a way of oxygenating the blood through a machine. Manually through the machine.
ECMO stands for extracorporeal membrane oxygenation. It essentially takes over heart and lung functions for people who have a severe or life-threatening illness. It's a unique treatment for COVID, offered only at Community Regional.
Right now in Central Valley, we're the only one who does ECMO for COVID infection at this point. And the reason is because this needs a very specialized team. The team consists of many people. We're talking about from surgeons, cardiothoracic surgeon, critical care doctors, and the respiratory therapists, nursing staff, perfusionist, physical therapist who's working on these cases while on ECMO. All these people, just extremely important part of the team. So to be able to create a team like that, this is not an easy task, but I think we're very proud of UCSF CRMC to have a team like this.
A lot of people helped me out, and I'm thankful for the staff because they really did help me out, emotionally, physically, everything.
And after 28 days of ECMO, she's able to come off of it, which is really incredible outcome. And after a few weeks, she's off the ventilator, and that's really the important thing. And right now she's in acute rehab, going back to her usual normal life.
Gabby spent weeks in the Leon S. Peters Rehabilitation Center where she regained her strength. She wasn't able to see her baby until a month after Madeline was born, when she was able to hold her for the first time.
She was definitely at the right place, the right people. A lot of doctors, a lot of nurses. Definitely thank you. They saved her life. And they were always there for me when I called every day.
Gabby would not be home today if it hadn't been for the team of specialists who cared for her. The doctors, nurses, ICU, NICU, rehabilitation experts, and more. Because of them, Gabby is now ready to start the new chapter of her life.